Yeah, that was the proud moment. New Orleans' first urgent care clinic dedicated to mental health opened in the Bywater, happened this summer. Talking about mindful horizons and wellness, it aims to provide quick help, also reduce the stigma around mental health treatment. That's the big one here. Owner Dr. Brittany Harrison is here in the studio this morning to tell us more about the clinic and her mission. Good morning to you, Dr. Harrison. How you doing?
Hey, Brandon, I'm doing well. How are you?
Doing all right. So seeing the video of the official ribbon cutting this summer, looking at your face and the excitement, it was a long time coming for you to achieve this goal. Tell us about it.
Yes. So I have been a psychiatric nurse practitioner for over 10 years now, working in various settings, inpatient, outpatient, ag teams, telehealth, and I saw that there was a huge need for immediate access to mental health care treatment. So patients who are discharged from hospitals, they usually have to wait for weeks, sometimes months at a time, to get an appointment for their mental health treatment. So I said, okay, what can I do to close that gap? Let's open a walk-in mental health facility where you don't need a scheduled appointment to come in and receive treatment. So I offer psychiatric evaluations, which are comprehensive, medication management services, therapy services, also crisis stabilization services at my center.
You invited me over to come take a look at what y'all offer over there, and I was taken away by this overall feeling of calmness, making sure that people have a safe space to feel comfortable.
That's right. So I wanted to have a warm and welcoming environment using bold but yet vibrant colors just to stimulate the brain's reward system so that patients may feel happier when they come in and more energized despite their circumstances.
Because the thing that we don't want to do here, and you were telling me, is call 911 or have an ambulance come pick you up, and the city doesn't want that either.
That's right. We want to reduce hospitalizations. We don't want the patients to wait in the ER for long periods of time, which can make their problems worse, actually. So they can come to my center. We partner with the New Orleans Mobile Crisis Unit. They come over and bring patients to us where they can be seen and stabilized at our center and can avoid hospitalization if possible.
Yeah, I was looking at the city's dashboard for mental health calls, and the crisis unit, the civilian group there, handles more than half of the calls that they get, and more than half of those calls are non-emergency related. So it speaks directly to what you're trying to accomplish.
Yes, it does. Yes, it does. So I'm able to stabilize the patients at my center. I partner with the pharmacy that fills medication right across the street, MedPro Pharmacy. They fill their medications within 10 to 15 minutes. So the patients actually leave with medication and they can come back for follow-up and ongoing management.
You mentioned the pharmacy there, but you got other community partners too.
Yes, I do. A referral partnership with Oxnard Community Health Center clinics. They refer their patients, their primary care patients and pediatric patients, to me for mental health services, as well as Operation Restoration, which is a nonprofit for formerly incarcerated women who are trying to reintegrate into society. So I see all of those women for mental health treatment, as well as Judge DeLarge's mental health and drug court and reentry program. So all of those participants come to see me for their mental health treatment.
Dr. Harrison, we got about 30 seconds left, but that seems a tall task, a lot of responsibility on you to reverse this stigma. How do you do it?
Well, through God. Yes, that's first. I am blessed, and this is my calling. So I also go to homeless shelters and see patients there. And I collaborate with other partners, agencies that offer psychosocial rehabilitative services in the community for therapy. So we can meet patients right where they are.
Do you see further growth for yourself in the clinic?
Yes, I do. Yes, I do. Want to see one in every corner, if possible. But really, in the school system is a priority. We just want to be able to reduce the suicide rates. Very important work that you're doing there, Dr. Harrison, excuse me. There we go, I'm telling my business. I've known Dr. Harrison since we were in high school, as Xavier Prep alum, and so it's like, oh goodness, no, Dr. Harrison, so my apologies. Very proud of you and the work that you are doing there in the Bywater and just all around our community, and grateful to have you in to tell us all about it. Yes, thank you so much, Brandon. I'm happy to be here.
Of course, and if you would like to learn more about the services, also the accepted insurance there at the facility, go to our our website, wwltv.com, and we will link you to where you need to be. Got a link to bring you to the clinic's website to answer the many questions that you have. Again, thanks a lot, Dr. Harrison.
Thank you.
7:40.